The purpose of this training module is a review on equine vaccination. I want to start by introducing myself. I'm Dr. Josie Traub-Jurgitz. I'm a professor of equine medicine at Colorado State University, College of Veterinary Medicine, Biomedical Sciences, and I also serve as the equine commodity specialist at USDA APHIS VS Center for Epidemiology and Animal Health through a cooperative agreement. Dr. Angela Pelzel-McCluskey, who serves as the National Equine Epidemiologist for USDA APHIS VS, assisted with content for this presentation. So I wanted to start out by talking a little bit about the licensing of animal vaccines and other biologics. And this is conducted by the USDA APHIS Veterinary Services Center for Veterinary Biologics, abbreviated CVB. The goal of CVB is to ensure that there are veterinary biologics for the purposes of diagnosis, prevention, and treatment of animal diseases, and that these products are pure, safe, potent, and effective. The image at the bottom of this slide is a screenshot from the CVB website. I'd like to review with you the information that is provided on vaccine labels. The label on biologic products, such as vaccines, contains important information which accurately indicates the expected performance of the product. There are 5 levels of protection that could appear on a vaccine label, and they're designated by USDA based on the expected performance of the product. These include prevention of infection, prevention of disease, and this may be specific to one or more of the clinical syndromes associated with the infection, aid in disease prevention, and aid in disease control. And then there are other indications that I'll talk about on the next slide. The vaccine label claims that fit into the other category include benefits beyond direct disease control and might include reduction in pathogen shedding as one of the things that was detected during clinical trials or through challenge studies, duration of expected immunity, and if the product has been tested for safety in a subset of animals, such as pregnant mares, or there's a specific age indication for first vaccination, that may appear on the label. It's important that whoever is administering the vaccine read the label, not only to learn about the expected benefits of the vaccine, but also to read any precautions or handling recommendations that may appear on the label. Vaccines may be conditionally licensed, and the reason for a conditional license is that there's a need to meet an emergency situation. There may be a limited market, there may be a specific local situation, or other special circumstances. For example, the first West Nile virus vaccine for use in horses became available as a conditionally licensed product. Now all of the West Nile virus vaccines for use in horses carry a full license. It's interesting to note that once there's a fully licensed product to protect against a certain disease that's available on the market, all subsequently licensed products need to meet the criteria for a full license. Conditional license vaccines must have data supporting product purity, safety, and a reasonable expectation of efficacy, and this is usually through demonstration of a serologic response in the animal to vaccination. I'd now like to switch to adverse event reporting. Recommendations for reporting of adverse events related to animal vaccine use is that the manufacturer be notified, as well as reporting the event to the USDA APHIS VS Center for Veterinary Biologics. The program at CVB is called Veterinary Biologics Pharmacovigilance Program. The reporting of a lack of efficacy is also part of the product, so not just adverse reactions, but a failure to meet the label claim. Continuing on adverse event aspects, per the AAEP, American Association of Equine Practitioners, vaccine guidelines, the administration of multiple antigens at the same time increases the risk of adverse reactions. Several of the equine vaccines on the market have multiple antigens in a single vaccine. These are also called multivalent vaccines. They may be preferred as it only requires one injection to administer multiple antigens contained in a multivalent vaccine. The safety and efficacy of administering multiple different vaccines at the same time is unknown. For vaccine trials for licensing purposes, only one vaccine is given and the response to that vaccine is studied. When multiple vaccines are given at once, as may be convenient and cost effective for the equine owner because they're given all in one visit, there's the potential for increasing adverse reactions. Also to note, the administration of modified live virus vaccines and kill vaccines at the same time should be avoided, as the adjuvant in the kill vaccine may inactivate the modified live vaccine antigen. In this photo, you can see a young animal that has feces and mud caked on the hair coat. And per the manufacturer's instructions, aseptic techniques should be used when administering vaccines. Therefore, the horses should be groomed and be clean when vaccinated, and a new sterile needle used to administer each vaccine product. There should be no sharing of needles between horses, as bloodborne pathogens can be spread by sharing of needles, and reuse of needles can get contaminated and spread bacteria that may be on the coat or in the environment. It's important to read the label on the vaccine regarding route of administration. There are intranasal vaccines, and they should never be given intramuscularly. Abscesses have occurred when intranasal vaccines that contain a modified live Streptococcus equi antigen were inadvertently given intramuscularly. This occurred specifically when owners, more used to giving intramuscular vaccines, gave this product that was meant for intranasal administration intramuscularly. There also were reports of situations that even when the modified live strep equi vaccine was given intranasally, while at the same time a different vaccine was given intramuscularly, abscesses formed at the intramuscular vaccine administration site. There are also autogenous vaccines that are used in some horses. Autogenous vaccines are those that are made from herd-specific antigens. Their use is under the direction of a veterinarian, and on this particular slide is the URL that explains the status of autogenous vaccines from the CVB perspective. Based on an internet search that I did regarding equine autogenous vaccines, and this slide is a list of those that I found. One was a strangles vaccine from MVP, another a melanoma vaccine, a sarcoid vaccine, and a papilloma vaccine. The link to the AVMA guidelines related to autogenous vaccines is included on this slide. Now I'd like to talk a little bit about the vaccine guidelines from the American Association of Equine Practitioners, or AAEP. They have several guidelines, including one for equine vaccines that's available to both non-members and members of the AAEP. And this slide has an image of the AAEP website where the guidelines for various indications are listed. So there's one on vaccines, there's one on infection control, and so on and so forth. Regarding the AAEP vaccination guidelines, the take-home message is that the vaccine program for a given horse or horses on an operation need to be tailored based on several factors, including risk of disease, consequences of disease if it occurs, effectiveness of the vaccine, potential for adverse events from the vaccination, the cost of immunization compared to the cost or consequences of disease occurrence. This slide has an introductory statement from the AAEP vaccination guidelines, and it emphasizes the need to involve a veterinary practitioner in the decision-making related to a vaccine plan, and that the guidelines are not a directive or in any way serve as a regulatory or regulation capacity. The vaccination guidelines for the AAEP are divided into specific categories based on the age of the horse, risk of exposure, use of the horse, and previous vaccination history, and I'll illustrate that in some of the subsequent slides. There's also a division of core vaccines and risk-based vaccine recommendations. Again, specific recommendation for foals and weanlings, adults that are not broodmares, and adults that are broodmares. This slide shows a screenshot that's a table for the vaccines for foals that are core vaccines and includes a column for foals born to previously vaccinated mares and those born to previously non-vaccinated mares. This slide has an image of the table for adults divided into recommendations for broodmares as well as other adult horses, and for those whether they've been previously vaccinated or previously not vaccinated with the core vaccines. This slide has a description of what AVMA defines as core vaccines, irrespective of the type of animal, and there are those vaccines that are designed to protect against endemic disease, those with potential public health impact, those required by law, and as far as I'm aware, none are required by law for equine, or where the antigen is particularly virulent, the severity of disease caused by the agent, or is highly infectious. Core vaccines are those with a high level of efficacy, safety, and thus benefit is high enough to justify their use in the majority of patients. This slide has a list of the vaccines that are categorized as core for horses, and they include vaccinating against tetanus, Eastern equine encephalitis and Western equine encephalitis, rabies, and West Nile virus. And there's also a listing of the type of vaccine that each of these represent. On this slide is an image of a horse with tetanus in the upper left-hand corner. Horses are very susceptible to the toxin produced by Clostridium tetani, the bacterial cause of tetanus, and they have a high risk of exposure from infection of small wounds that may go unnoticed by equine owners. The slide also has an image of a horse in a sling that had West Nile virus infection prior to the availability of the vaccines that now are available for prevention of this disease. The case fatality rate in unvaccinated horses infected with West Nile virus ranges from approximately 30 to 40%. For Eastern equine encephalitis infection, the case fatality rate in horses exceeds 90%. Rabies is fatal in all infected horses, and affected horses pose a public health risk. The article shown on this slide illustrates that rabies infected horse was detected at a public event. In this situation, it was the 2006 Tennessee Walking Horse National Celebration. This slide has a list of risk-based equine vaccines according to the AAEP guidelines. I don't plan to go into each of these in detail, but I will highlight several in the subsequent part of this presentation. Some of the more recently licensed equine vaccines are not listed on the AAEP guidelines. One of these is a Rhinitis A vaccine manufactured by Boehringer Ingelheim. The vaccine is abbreviated ERAV. It's important to know that this is not a rhino vaccine. Rhino is the term used by horse people to describe the disease caused by equine herpes virus. This vaccine, per the manufacturer, is intended for vaccination of healthy horses 4 months of age or older for immunization against Rhinitis A. Rhinitis A infection has been associated with clinical signs similar to equine herpes virus respiratory syndrome and equine influenza infection. Another recently licensed equine vaccine, also manufactured by Boehringer Ingelheim, is the pigeon fever vaccine. Pigeon fever is caused by a bacteria called Corynebacterium pseudotuberculosis, sometimes abbreviated Corynea pseudo-TB, and is associated with abscesses in several locations, including in the pectoral area, so that's how it gets the name pigeon fever. It also can cause abscesses on the ventral abdomen and in some cases internal abscesses. That particular vaccine has been removed from availability in April of 2015 because of systemic reactions in some vaccinated horses once it became available and used in the general population, and the manufacturer is hopeful to soon get it back onto the market. The AAEP does not provide guidelines for vaccines that are not licensed for equine use. On this slide, I've listed some vaccines that we're aware of owners and their veterinarians may be giving to horses, and there may be others in addition to this list. For example, in the northeast part of the United States, we know that some equine practitioners are administering the canine Lyme disease vaccine to horses to try to protect them against Lyme disease. For the remainder of the presentation, I'll be going into a bit more detail on selected but not all of the risk-based vaccines. Equine influenza H7N7 was first reported in 1751, but it has not been detected in the equine population since the 1970s. The H3N8 virus was first isolated in the United States in 1963 and continues to circulate in large parts of the world except in Australia, New Zealand, and Iceland. Since the middle of the 1980s, the H3N8 viruses have diverged into two lineages, the Eurasian and the American lineages. Further distinct antigenic sublineage strains exist in the American lineage. Vaccination against equine influenza is an important and common practice in control of this disease, particularly in horses that have the risk of exposure because they come in contact with horses outside of their regular herd or operation. The value of the inactivated vaccines depends on the quality and the quantity of viral antigen and choice of adjuvant. The inclusion of H7N7 is no longer considered necessary for equine influenza vaccines, and since no Eurasian H3N8 strains of virus have been isolated in recent years, OIE experts indicate it is no longer necessary to include this lineage in the vaccine. There is an intranasal temperature-adapted equine flu vaccine, which has in challenge studies been documented to provide protection up to 12 months after a single administration, but the label claim duration of immunity is for 6 months. There's also a recombinant canarypox vector-based equine influenza vaccine that has shown excellent performance against recent circulating viruses, including those that have overcome modern inactivated vaccines. It's important to note that several of these equine influenza vaccines are examples of novel equine vaccine technology that is not based on the conventional inactivated formulations of vaccines. Now we're switching to equine herpes virus vaccines. These vaccines assist with disease control, but are not intended or marketed to provide complete protection from disease. Over a 20-year period, commercial equine herpes virus vaccines reduced the incidence of abortion in Kentucky broodmares, but the implementation of vigorous hygiene measures also occurred and had a major impact on reducing spread of the virus. In the National Animal Health Monitoring System's Equine 2005 study, approximately 64% of equine operations that vaccinated their equine for any disease and knew which vaccines had been given to some or all of their equine. Nearly 70% of operations with broodmares that knew which vaccines were given indicated they vaccinated them against EHV. There are no experimental or field studies that provide data on the ability of any of the commercial vaccines to protect against the neurologic form of equine herpes virus infection. In 2 case control studies conducted related to EHM incidents, more recent or more frequent EHV vaccination was associated with an increased risk of development of the neurologic form of EHV1. In both of these studies, primarily the low antigen inactivated EHV vaccine had been used prior to the outbreaks. Now we're going to talk about equine arteritis virus vaccine. The disease caused by equine arteritis virus is equine viral arteritis, and it results in fever and edema in the limbs and ventrum. It can also result in abortion in pregnant mares. Stallions can become persistent shedders of the virus if unvaccinated, thus infecting mares that they breed, who then introduce the virus into the broodmare bands with which they cohabitate. Some of these mares may be pregnant in the herd and once exposed to the virus, developing infection and abortion. The virus can be present in shipped semen collected from infected stallions. Vaccination of stallions is used as a way to prevent infection and thus prevent shedding of the virus in semen. If a stallion is found to be a persistent shedder, then the mares bred to the stallion should be vaccinated prior to natural cover or insemination. This vaccine is considered a risk-based vaccine by the AAEP. Now we're going to talk about strangles vaccines. There are adjuvant extract vaccines that are available for the control of strangles. Per a team of subject matter experts that published in the text Equine Infectious Diseases by Sellon and Long, the efficacy of these extract vaccines have been disappointing, with little published data to support significant protection. These vaccines have been associated with an increased rate of injection site reactions compared to other equine vaccines. There's also an intranasal modified live vaccine for use in controlling Streptococcus equi, which causes strangles, called Pinnacle IN for intranasal. It was designed to mimic the immunity provided through natural infection and stimulated a high level of immunity against experimental challenge. This modified organism may have residual virulence with formation of slowly developing submandibular abscesses in a small percent of the equine vaccinated. Because the vaccine contains live strep equi, accidental contamination of remote injection sites will result in abscesses at these locations. Therefore, ideally, no other vaccines should be given concurrently with this intranasal vaccine, or they should be given prior to the intranasal strangles vaccine. Based on the NAHMS Equine 2005 study, approximately 3/4 of equine operations gave some type of vaccine to their equids. Of those operations that vaccinated and knew the vaccine types given, the largest percent vaccinated against West Nile virus, tetanus, Eastern equine encephalitis and Western equine encephalitis, influenza, and equine herpes virus. Only 44% of operations that vaccinated and knew what vaccines were given vaccinated against rabies. For operations that gave vaccines to resident equine in the previous 12 months, the primary reason for not giving flu, strangles, equine herpes virus, rabies, EEE and WEE, and tetanus or EVA vaccines was little risk of exposure. For operations that did not vaccinate against West Nile virus, the primary reason was concern about adverse reactions or ineffectiveness of the vaccine, and this was higher than for the other vaccine types. It's important to note that initially when West Nile virus vaccine was available, it was under a conditional licensure, and this led some people to be concerned it was not safe or lacked efficacy. Since the initial conditional license vaccine for West Nile virus was available, several West Nile virus vaccines have now gotten a full license and have been shown to be effective in challenge studies, and they've been evaluated for safety and not been associated with more adverse reactions than occur with other core vaccines. In summary, a comprehensive infection control plan has 3 components, including reducing the risk of exposure to infectious agents, minimizing factors that would reduce resistance to disease if exposed, and also enhancing resistance to disease through vaccination. So it's important to note that vaccines are an important part of infection control, but are not the only aspects of infection control that need to be considered.